Good afternoon. I'm James Mackey, and this is your annual training on HIPAA compliance. By the end of this training, you will know how to operate within compliance of the HIPAA guidelines, and you will become more familiar with the HIPAA security rule. You will know the difference between PII, PHI, and EPHI, and you will know the steps it takes to properly safeguard and disclose this information. HIPAA stands for the Health Insurance Portability and Accountability Act. It encompasses a security rule, and the purpose of that rule is to provide a standard for the storage, use, and transmission of healthcare information. It requires specific administrative, physical, and technical safeguards, and it ensures that policies are set to limit the disclosure of PHI. So why is it that we care about HIPAA so much? Why is it that we need to comply? And that is because we fall under the category of a covered entity. That is because we are healthcare providers, and every day we have access to, we use, and we disclose PHI. Other examples of covered entities would be non-medical staff and business associates. PII is personally identifiable information. This is information such as driver's license number, social security numbers, date of birth, place of birth. That is because this information can be used to track or recognize an individual. It's also used to commit a variety of cyber crimes like fraud and making unauthorized purchases. PHI is protected health information, and this is any health information that can be used to identify an individual. Things such as medical record numbers, prescriptions, account numbers. The only difference between PHI and EPHI is that EPHI is protected health information that is stored and transmitted electronically. Every covered entity should have a goal to safeguarding patient information. And we do this by implementing physical, technical, and managerial safeguards. A physical measure would be locks, secured rooms like the server room, or shedding documents with PHI on it. A technical measure is anything that me as an IT professional would be implementing. So that's encryption, intrusion detection systems, backing up our data regularly to make sure that it's available. Managerial measures would be employee training or incident response plans. We do all these things to make sure that the confidentiality, integrity, and availability is always intact. I would also like to add that a technical control is anything that utilizes technology. HIPAA has a risk assessment tool that is a technical measure, and it is a downloadable tool that helps assess the security of EPHI. This is to ensure that we are always in compliance with HIPAA's safeguards, and it also reveals where EPHI could be at risk. HIPAA security rule assists in knowing how to disclose PHI and EPHI. Covered entities may disclose this information if a patient gives written approval. Also, if it's necessary for payment healthcare operations, and if it's requested by law enforcement. Covered entities must disclose EPHI if the patient requests it, or if it's for a compliance audit, an investigation, or a review. Failing to comply can lead to significant financial and criminal penalties. Organizations could be fined up to $50,000 per violation, and individuals could be imprisoned up to 1 year. Other consequences could be loss of trustworthiness or less clients. Individuals who accidentally violate HIPAA should immediately report it to their employer, because if not, they could be held criminally liable and terminated.